Bismillahirrahmanirrahim. Assalamu alaikum. I'm Dr. Ambreen and I'm the instructor of the subject Pharmacology and Therapeutics 1. I'm glad to be here. Today I'm going to deliver you a lecture on hypolipidemic drugs. And today's lecture basically includes the learning objectives that will have basically includes the key features of the previous lecture that also in which we will also discuss about the today's topic that is basically related to hyperlipidemic conditions which we use hypolipidemic drugs. Inshallah, in the next lecture, we will move towards the anti-arrhythmic drugs and discuss about arrhythmias and how we can use different pharmacological agents to reduce the arrhythmic conditions. So coming towards the previous lectures, let me revise. Previously, we have studied about hypertension, in which we have studied about the normal physiology of the blood pressure, that what's going to happen that when the body's blood pressure is going to decrease, and how the renin-angiotensin system and how the baroreceptor reflexes are going to control the or maintain the blood pressure. Then we have studied that hypertension is considered to be a silent cause of the death, and there are so many adverse effects, or maybe the on the long cases if the hypertension continues. So then we need to do is we need to basically do some lifestyle modification. If there is no change in the blood pressure along with lifestyle modification, then we have to move towards the pharmacological management. That includes various drugs like diuretics, ACE inhibitors, angiotensin 2 receptor blockers, alpha blockers, beta blocker, calcium channel blocker. So we have actually studied about all these drugs, their actions, the mechanism of action, and their adverse effects. Moving towards the today's topic that is basically related to hypolipidemic drugs. For this, we must know about the normal physiology of hyperlipidemic conditions and how the low density lipoprotein, very low density lipoproteins, and HDLs are going to act. For this, I am sharing you a video, and this we will revise normal physiology, how these drugs are going to act, and how these HDL, VLDLs, LDL, the basic lipoproteins are going to work, and what they are, what is their normal functioning. So for that, we are going to watch a video in which I will describe the whole process. So what happens if a person has hyperlipidemia means hypercholesterolemia, and high levels of the cholesterol in the body. And the cholesterols are basically lipid-like or fat-like substances that are of two types in nature, like triglyceride and cholesterol. So these are the two substances that are going to tell you about the level of the cholesterol and triglycerides in the blood. Coming towards the cholesterol, cholesterol is required for the normal functioning of the body, and it is synthesized in our liver. And but why we need to synthesize this cholesterol? Because cholesterol is used for the cell membranes for their normal functioning. Cell membrane, skin also uses the cholesterol for the vitamin D synthesis with the help of sunlight. Testicles in man, adrenal glands also need cholesterol to make some chemicals named as different hormones. Liver also uses cholesterol to make bile acids, and this bile acids is basically required for the digestion of the fats in the food. Triglycerides are also considered to be a source of energy that basically comes from the food and from the liver. Primarily, the food that have triglycerides include fatty acids, refined carbohydrates, simple sugars, and alcohols. Now coming towards how liver is going to treat with the lipids. From liver, the lipids are not able to move in the bloodstream without some adjustment. The liver do some adjustment. Liver do wrap these proteins into some protein like lipids into protein like chains and makes lipoproteins. And what's going to happen? The level of the type of the lipoprotein is now going to tell either your body has a bad cholesterol or either the good cholesterol. So liver is going to produce very low density lipoproteins. It also produces low density lipoprotein. So depending upon the type of lipoproteins, we are going to then say the level of the cholesterol or triglyceride in the body. Coming towards the very low density lipoproteins, they are stuffed with cholesterol and triglyceride. So what they are going to do is they are going to travel to the bloodstream and they deliver the triglyceride to these cells. You can see they are going to deliver the triglyceride to the cells and provide the energy to the cells. If the liver forms VLDLs more than the requirement of the energy, what's going to happen is they are going to give this extra triglyceride to body tissues and going to accumulate as body fat. So after losing a triglyceride, the VLDLs convert into low density lipoproteins that basically have a less content of triglyceride and basically have cholesterol in them. LDLs travels through the bloodstream, delivering the cholesterol to the cells that need it. If our body makes too much cholesterol, LDL, it can deposit in the walls of the vessels, causing a buildup of fatty acids, and that is named as plaques. You can see the plaques. And when these plaques are going to accumulate around the vessels, they are going to constrict the diameter and reduce the diameter of the blood vessel. So they reduces the blood flow. They not only accumulate in these blood vessels, they all may accumulate other vessels also. Let's suppose if they get commonly accumulate in the coronary blood vessels, they are going to cause coronary artery diseases. They may also accumulate in the blood vessels that are going towards brain at the level of the neck and may decrease the level of the blood flow towards the brain, and due to which there would be stroke. So the blood also contains high density lipoprotein. These are considered to be good fats. Why they are considered good fats? Because they have a less amount of triglyceride and cholesterol, and they have high levels of the proteins in it. And what's going to happen? These high density lipoproteins are going to absorb the extra cholesterol from the cells. It also absorbs the plaque and cholesterol around the vessels and normalizes the diameter. So this was actually and then these high density lipoproteins are going to deliver the extra amount of the cholesterol to the liver. So actually the process and the reason I am explaining this, the HDLs, VLDLs, LDLs, in order to understand the clear cut and their concept. So coming towards the today's topic, that is basically related to this lipidemic conditions, that in which we are going to study hypolipidemic drugs, the drugs that are going to reduce the lipid level. Basically, why we need and in which conditions we preferably need is because in coronary heart diseases we prefer to use it, because coronary heart disease is one of the common disease that is going to cause so many deaths. The incidence of the coronary heart disease is correlated with altered levels of the lipoproteins like chylomicrons, LDLs, VLDLs, HDLs. So what's going to happen is there are a number of the risk factors that may affect this coronary heart disease. They can either be genetic. More common are smoking, hypertension, obesity, diabetes, lack of exercise, consumption of the diet containing saturated fatty acids. So these are the factors that are going to command the rate of the cholesterol in the blood. Occurrence of the coronary heart disease is positively associated with a high total cholesterol and even more strongly with the elevated LDL cholesterols in the blood. So if a person is at a risk of having CHD, mean coronary heart disease, it means the person is actually having more cholesterol level, more LDL levels. So LDL levels are going to enhance the risk of coronary heart disease. In contrast to LDL cholesterol, high levels of HDLs, mean high density lipoproteins that are said to be good cholesterol, have been associated with decreased risk of the heart diseases. So what we have to do is we have to reduce these LDL levels, which is the primary goal of cholesterol lowering therapy. So when we have intention to lower the cholesterol level, our intention is basically reduce these LDL levels. This is a normal chart that is going to show you how what is the normal level of LDL cholesterol. See, the total cholesterol should be around 200, and the amount of the LDL should be around. Let me on the marker, I'll show you. And then see this LDL cholesterol should be at borderline of 130. If it increases from this range, it is said to be more. If the level of HDL should be 40, if it is less than 35, it's harmful, it's not good. So it should be greater than 60 in usual condition. The amount of the total cholesterol in the blood should be at least 200, and if it is greater than this, you are moving towards the risk of having hypercholesterolemia. So what is hypolipoproteinemia? Hyper means more, Lipo mean lipoproteins, emia mean in the blood, hypolipoproteinemia, the condition, and where the concentration of the cholesterol and the triglyceride carrying proteins in the plasma are elevated above normal. So when the lipoproteins increases, development of atherosclerosis is elevated above normal. So there will be more risk of having myocardial infarction if the atherosclerosis is going to increase. So coming towards again on the lipoproteins, we said there are three types, commonly three types of the lipoproteins: LDL, VLDLs, and HDLs. VLDL and LDL are bad like cholesterols or bad lipoproteins, while HDL are considered to be good fats. So what LDL is going to do? LDL is basically the primary carrier of the cholesterol, while the VLDLs are primary carriers of triglyceride by nature. So what we have to do in ultimately in the patients of hyperlipidemia, we need to do is we can use hyperlipidemic drugs. We may try to reduce the body weight. We may also try to reduce the cholesterol diet in their daily habits. So moving towards the therapy, we have to deal with two things. We have to either decrease the triglyceride level or either we have to decrease the cholesterol level. So if a patient have a high cholesterol level, we will say it hypercholesterolemia. With the patient will have moderate hyperlipidemia, lifestyle modification is a very necessary, such as diet improvement, healthy diet should be taken, exercise, weight reduction. It's like more like factors that should be focused. And because they can lead to the modest decrease in LDL levels and increases the HDL level, this is the good thing that they increases the HDL levels. So if the person is not able to get better with these lifestyle modification, then he may move towards the drugs that are going to lower the cholesterol level in the blood. Coming towards the hyper mean high triglycerides in the blood. Elevated triglycerols, they told us, they are independently associated with increased risk of coronary heart disease. So diet and exercise are the primary modes of treating these hypertriglyceridemia. We may also use the drugs that also reduces the triglyceride level in the blood. Now moving towards the classification of the drugs that are being used in these hyperlipidemic conditions, they are named as hypolipidemic drugs. They have certain categories, and the most commonly one used them is HMG CoA reductase inhibitor, HMG hydroxymethyl CoA reductase inhibitor. The names are lovastatin. The word statin comes at the end. Simvastatin and pravastatin. Lovastatin, simvastatin, and pravastatin. Coming towards the next class, that is basically fibrate. That includes gem, fibrizole, clofibrate, phenofibrate. HMG-CoA reductase inhibitors, lovastatin, simvastatin, pravastatin, fibrate, gemfibrozole, clofibrate, and phenofibrate. The next class we have is bile acid sequestrants or bile acid binding resins. They are closteramine and clostipol. Next we have is antioxidants, probicol. And we also have a miscellaneous class called with the name of nicotinic acid, acetamide, this zetia. It's familiar with the name of zetia, and neomycin. Let me discuss statins in detail. In this, we are going to discuss about the mechanism of action, their adverse effects, their uses, their pharmacokinetic profile, and also discuss about the adverse effect as well. So, what mechanism of action, adverse effect, pharmacokinetic profile, and uses. So, what statins is, statins are basically going to act on the liver. Why they are going to act on the liver? Basically, they has to inhibit the cholesterol synthesis. So they by nature are the one that are going to reduce the cholesterol synthesis. Basically, the synthesis of the cholesterol is going to take place in the liver. So it acts on the one of the step of the final. It is acts on the basically the final step of the cholesterol synthesis. That is with under the action under the role of the enzyme named as hydroxymethyl glutarate CoA reductase. So this is the enzyme that converts the HMG CoA into mevalonate, and this is the final product that is going to give you cholesterol. So AGMG-CoA reductases, which are also named as statins, basically act on the liver on the cholesterol synthesis pathway. They act at this level. They convert the HMG. Usually, the HMG-CoA enzyme convert reductase enzyme converts HMG-CoA to valinate, and that is going to give you cholesterol. So what this drug do is this drugs inhibit this enzyme that is going to act at here, that is HMG-CoA reductase. Basically, they are competitive like antagonist of this HMG-CoA reductase enzyme, due to which they inhibit this step, due to which cholesterol is not going to synthesize. What the statins are? They're competitive inhibitors of HMG hydroxymethyl butyl CoA reductase enzyme inhibitor. They lowers the plasma LDL cholesterol, and also they have action on the triglyceride. They have more affinity for this action and less affinity for this action. And along with this, they also increases by 10% the HDL levels. So this also helps to reduce the cholesterol, bad cholesterol. Coming towards the pharmacokinetic profile, they are basically well absorbed. They are given orally, preferably, and simvastatin is a prodrug, meaning the drug that is initially inactive, and when it comes into body, its metabolites are basically active. Adverse effects. One of the very common adverse effect of statins and fibrates is GIT disturbance. This is the most usual and most common effect that is seen with these statins and fibrates. The next class. The next is the patient may have insomnia, headache, rashes, angioedema, and the most another very rare sign is hepatotoxicity. These statins affect the liver. If they affect the liver, then what should we do is we should try to use them, avoid to use them. So how you can check how it is going to affect the liver? Liver function test should be like properly carried out after every month, and we should also look for the serum transaminase level, and that is elevated in the prolonged therapy. The patient should be watched for the hepatotoxicity when they are on statins. All the statins have very other important adverse effect, that is myopathy. These myopathies are basically due to the rhabdomyolysis. Rhabdomyolysis is disintegration and distillation of the muscle that causes the muscle aches and myalgias. Coming towards the precaution means the condition in which we are use with like precaution or should avoid to use. Concurrent use of other drugs may cause myopathies like fibrates and niacin should be avoided along with this, or may be used in low doses with this. Contraindications of the statins. Contraindications mean the condition in which you should avoid to use these drugs. Like they must not be used in pregnancy, lactation, and children, and as well as should be avoided in teenagers. So where the statins are being used, the summarized and simplest like thing is they are going to reduce the cholesterol levels. They must be preferred in the patient who have myocardial infarction, angina, stroke, ischemic attack to lower the cholesterol levels. This is considered to be first-line drug in hyperlipidemic conditions of both the genetic issues or due to secondary or lifestyle issues. So this was all about statins. The long and short is statins are basically the drugs that are going to inhibit HMG-CoA reductase enzyme, and due to which they are going to decrease the synthesis of the cholesterol. So the common adverse effect faced by these drugs are GIT disturbances, hepatotoxicity may occur. So you must check for the serum transaminase level, and the next patient usually have myalgia. So in the physiotherapy practice, when we are going to have interaction with the with the patients, one thing you must think these drugs are going to cause muscle aches and myalgias. So usually a patient comes to you and he gives you a history of muscle aches throughout the body and especially in the limbs. And what you should think of is you may think if the patient is either one of the differential diagnosis is you may look for either the patient is taking any drug that is going to control the cholesterol level. So you may also check through overall history of the patient if the patient is taking statins and is using for a very long time. So it might be due to this. If it is not obvious any other obvious cause, then the pain may be due to the use of the statins. Coming towards the fibrates, that is the next class of hypolipidemic drugs. Fibrates are basically the drugs that lowers the triglyceride level. So what they do is they lowers the triglyceride level. Previous one class lowers the cholesterol level. So they are preferred in fibrates are present in high triglyceridemic conditions. What are triglycerides? Another point is we said triglycerides is a type of fatty lipids, and these triglycerides are basically being used as a source of energy or that we get from our food and by the liver. And these are the two sources that are going to give you triglyceride in your body. Looking towards the lipid profile, what it has, we usually look for the cholesterol, triglyceride, HDLs, LDLs. And here, right now, in the case of fibrates, we are looking for the triglyceride. Usually, the triglyceride should be less than 150 milligram per deciliter. And if the level is higher than this, then we may look for these fibrates. For example, let's say this person who is having the triglyceride level around 400 milligram per deciliter, and what's the need here is we must reduce this level of triglyceride. For this, we are going to use these fibrates, because if they are not being treated, hypertriglyceridemia will lead towards the heart attack. It may lead towards a stroke. It may lead towards the heart disease. So fibrates are preferably being used in hypertriglyceridemia. Now coming towards the mechanism of action of the fibrates, how they are going to act. Fibrates are also called PPARA activators. They are basically going to act or going to prevent the triglyceride synthesis. How they are going to prevent? Usually, there are free fatty acids, and three free fatty acids is going to combine under the liver's action and going to give you triglyceride. But what these fibrates are going to do is these fibrates are going to act on the DNA and going to give the message and going to convey a message to increase the level of lipoprotein lipase. These lipoprotein lipase are the enzyme that will degrade these free fatty acids. When these free fatty acids are degrading, they are not going to ask the liver to make this triglyceride, and they are going to reduce the level of the triglyceride. I'm again going to repeat, the fibrates actually increases the activity of lipoprotein lipase. You can see these lipoprotein. These lipoprotein lipase, they are going to inhibit this free fatty acids and going to degrade them. As a result of which, they are not going to form triglycerides. Coming towards this summarized view, you can see first step is they are going to act on the DNA. They are going to increase the activity of lipoprotein lipase. Then they are going to inhibit these free fatty acids, and the liver is not able to convert it. There is less amount of triglyceride level. So what they are going to do is they are going to reduce the triglyceride. They also increases the HDL, and they also decreases the LDL level. So this is the summarized view of the mechanism of action of the fibrates. Let me tell you the common side effects that are being faced with the use of fibrates. One of the very common is liver toxicity and muscle pains. They are exactly like the statins. They must not be combined with statins. They also causes cholecystitis, mean gallstones formation. And the very common side effect of these drugs is they causes nausea. Statins and they both are very familiar to cause the nausea. The third category that we are going to discuss is bile acids castrants. To that, for this, we must know what the bile is. Bile is basically a digestive juice that is basically synthesized in the liver, and how the liver synthesizes, liver utilizes the cholesterol and synthesizes bile. And then they store this bile in the gallbladder. So what's going to happen is this bile acid is going to stored in the liver, or synthesized in the liver with the help of cholesterol, and then it is going to stored in the gallbladder. And when it is required, it is comes here in the intestine, and it causes the digestion of the fats and foods. It helps to absorb the foods, the cholesterols, and the fat soluble vitamins like A, D, E, K. So now we are going to have the topic of discussion, that is bile acids questions. So when the questions come, it means I always think sequestrant means silence or stop. So here it means bile acid silence or bile acid stop. We want to stop this bile acid action. Why and how? This is the main thing we'll discuss in the mechanism of action. Coming towards the lipid panel, I said there are total cholesterols, triglyceride level, HDL, and HDL. These bile acid binding regions are going to act on LDL cholesterol and it tends to decrease it. So they are going to, in short, reduce the low density lipoproteins, and that thus they prevent by prevent the reusage of bile acid. How it prevents the reuses of bile acid? Let me explain. I earlier said the liver synthesizes bile juice with the help of cholesterol, and then it gets stored in the gallbladder. And you can see here the juice is like stored. So when the fats come in our food, this is your fat, it comes in the food, and this bile juice attaches and try to emulsify it and try to dissolve it. Fine. What are bile acid? And okay, fine. When it emulsify or digest it, and 97% of it is going back to the gallbladder and gets stored in it. Right now, in the case, if the fat has combined to the yellow molecules that are basically bile acid, the bile acid sequestrants are going to come to bind with this bile, and after binding to this bile, it causes bile to excrete out of the body instead of being reused again and prevent the uses of these drugs. I'm not going to repeat it. We said the bile acids come into the intestine and tends to dissolve or absorb the fats. It tries to dissolve them and break them into small components, and then it goes back to the gallbladder, and about 97% of the bile get restored and may be reused. But what we do if we causes this bile acid sequestrants to bind to the bile acid and form a complex and then carry this bile acid out of the GIG or out of the intestine in our feces, then what is going to happen is there would be less amount of the bile in the gallbladder, so due to which they are going to ask the liver to give us the bile, and as a result of which this liver uses the cholesterol, and the use of the cholesterol is going to be occur and going to cause the bile formation, due to which the amount of the cholesterol that is randomly moving here and there is going to be utilized again. So what we said, gallbladder, when we are going to use these bile acid sequestrants, they are going to take this bile to the excretion, and due to which it will be not reused, as a result of which this empty gallbladder is going to ask the liver to make more bile, and when it makes more bile with the help of the cholesterol, it decreases the level of the very low density lipoproteins. So in this way, it reduces the very low density lipoproteins. Coming towards the side effects, let me tell you, when you are going to increase the triglyceride, is going to decrease the LDLs, you are going to increase the triglyceride. Ultimately, there is another very common effect is constipation, decreased absorption of the other drugs. Choking can also be found due to this effect. What these drug bile acid binding sequestrants are going to do is they decreases absorption of other like warfarin, digoxin, thiazides, vitamins like A, D, E, K. So they actually somehow affects the other drugs as well. Long and short story is bile acid binding regions bind to the bile acid, where in the intestine increases their excretion. We earlier said this. Bile acid is required in basically these bile acid required for intestinal absorption of the cholesterol. So when we have reduced the bile acid action, so we have also reduced the level of the cholesterol, the LDLs. And the other important thing is this drug is unpleasant in taste. It also affects the GIT, constipation, piles, and the earlier cell. Now coming towards another very commonly being hyperlipidemic drug that is being used is Zetia, azitimab. It's known as Zetia. What this Zetia is going to do and what it is, Zetia is basically going to lower the LDL levels, low density lipoprotein. How? It blocks the dietary cholesterol absorption. It absorbs the absorption of the cholesterol that is going to occur in the intestinal walls. Looking towards the lipid panel, we said it basically acts on the LDL cholesterol, fine. And how it acts on? It actually acts on by blocking the dietary cholesterol absorption. Let's take the example of this man who is going to take this burger and the hamburger and going to eat it, as a result of which his triglyceride or LDL level will be increased, and and in case if it is more than 150 milligram per deciliter, what we have to do is we have to load his triglyceride or cholesterol level. For this, we will use Zetia. What Zetia will do is Zetia will lower the LDL level. Another option is we may ask a patient not to take the hamburger, but if he doesn't like try to avoid it, in such a case, we have to take this management or measure. And ZTI is also being preferred in those patients who are hypersensitivity, like familial hypercholesterolemia. Those by nature they have a genetic issues, they are hypersensitive, have more cholesterol in their blood, they are preferably given the ZTI. Always recommend or always guide, consult your patient to eat healthy diet instead of these fast food or hamburgers. Sometimes patient is not able to to afford this healthy diet, so he try to get randomly or whatever is his approach he uses. So coming the details of its mechanism of action, we said when a person takes such fatty foods, it's going to come into the stomach, it reaches to the stomach, and then it comes to the intestine. Let's take a cross-section view of this intestine, which we are going to see what's going to happen. This is just intestine, and these like molecules of the burger has been degraded, and they are like this. They are cholesterol and they are carbohydrates and proteins, etc. Take these cholesterol as an example. What is going to happen is this cholesterol is going to get absorbed with the help of these transporter. They are NPC1Li. They are going to absorb this cholesterol, and they get usually this is a normal physiology, and then they cause the absorption of the cholesterol. What ZTI is going to do is ZTI is going to block this cholesterol absorption by inhibiting this enzyme and or this transporter NPC1Li, NPC1, due to which it is not going to carry any more cholesterol and will not absorb it, due to which cholesterol absorption is being reduced, due to which the LDL level is going to reduce. So what are the possible common side effects that we face with the ZTI? One of them is nausea, the other one is diarrhea. It is not going to absorb the cholesterol, so it is going to excrete out. The other very common cause is fatigue. So these are the side effects of ZTI. Let me explain the ZTI's mechanism of action. Once again, we will revise it. What it do is selectively inhibits the absorption of the cholesterol and the phytosterol by the enterocytes. It concentrates in the brush borders of the small intestine and thus interfere with the absorption of the cholesterol by inhibiting the transport protein NPC1Li, which shakes up the cholesterol from the intestine into the lumen. As a result, it decreases the clearance. It causes the clearance in hepatic cholesterol, leading to the increased clearance form of cholesterol. So it affects the LDL level and decreases by 15% to 20%, with a marginal increase of LDL level as well. The next we discuss about little about the antioxidant neomycin. What antioxidant name is propofol. It is also synthetic antioxidant that lowers the plasma cholesterol LDL levels and raises the HDL level. It is used with other hyperlipidemic drugs. It's not itself important, so you use them with other drugs. Coming towards the nicotinic acid, it also inhibits the lipolysis, lysis means breakdown of lipids, and increases the lipoprotein lipase activity, due to which it inhibits the free fatty acids, and prevents the formation of triglycerides. So it overall acts on lowering the triglyceride LDL level as well. Then we have a neomycin. It forms insoluble complexes with the bile acids in the intestine, thus lowers the cholesterol level. So coming towards the closing points of today's lecture, we have studied about statins, fibrates, and then about neomycin, probocol, about Zetia, and bile-acid sequestrants. So in summarize, we say if a patient have high LDL levels, statins are preferred, mean lovastatin is preferred. In case of high triglyceride level, fibrates are preferred and gemfibrozole is commonly being used. If a person has both triglyceride and LDL level raised, then we use fibrizole and lovastatin both. This was the three main points, the three summarized point of all these drugs that in which condition they are preferred. Then we also said bile acid binding sequestrants actually increase the bile acid synthesis. Statins actually inhibits the HMG-CoA reductase enzyme. Zetia decreases the intestinal cholesterol absorption. All of them are going to decrease the hepatic cholesterol and increases the hepatic LDL receptors, by which they are all going to decrease the plasma LDL level. This was all about the hypolipidemic drugs, how we can prevent these hyperlipidemic conditions, also how we can degrade them. Thank you so much. This was all. If you have any questions or comments, you can ask in your next interactive session, and even you can post your questions in your Google Classroom. Inshallah, in the next class, we are going to study about antiarrhythmic drugs in the next session. Till then, Allah Hafiz.